Welcome back, everybody. I'm Dr. Chelsea Kesty, and I'm joined by Dr. Kat Kesty. And today we're going to be talking about why some laser treatments fail. So, Dr. Kesty, why do some laser treatments fail to produce results?
I would say there's a lot of reasons why, for some people, lasers don't treat results, but I would say it really goes back to two main reasons. Number one, the wrong laser, and number two, the wrong settings. I would say there's so many different lasers on the market right now for each individual concern. Like if you're talking about even something as general as brown spots, you have to look at what is the brown spot? Is it a keratosis? Is it a solar lentigo? Is it a skin cancer? And then all of those different types of brown spots are going to have ideal lasers for that type of brown spot, and then further subdivided into different skin types. So there's so many different options, even for something as general as a brown spot, that unless you have access to all those different lasers, sometimes you can choose the wrong laser for the wrong indication and or the wrong skin type. And you could, best case scenario, not get results. Obviously, worst case scenario, have an issue like a burn or pigmentation change.
Yeah, I agree. I mean, I think there's in general, when we choose a laser, we want to make sure that the target or the endpoint is something that, has the science behind it, that we're targeting melanin, which is brown. We're targeting, hemoglobin, which is red, or we're targeting water, which is something ablative or taking off the skin layers if it's a thicker lesion. So all those types of things really change, what laser we're going to choose and how that can operate and then either fail to provide results or hopefully do provide results. So you have to know the science behind what you're actually targeting, choosing that wavelength, having the wavelength in-house or in the laser procedure, and then using that to its advantage.
Mhm. I agree with you. So let's talk about a really common question. Why do some patients need multiple laser sessions and some patients only need one laser session to get the results?
So everybody's going to be happy at a different endpoint for one. So some people are happy with just a small amount of rejuvenation. They just kind of want to look, a little bit, less tired or a little, this one brown spot is gone. There's different goals for every person. So some people are like, I want to look 20 and they're 45. Well, that's going to take a lot more sessions for me than it is for somebody to say, hey, I want to look, 6 months younger. Just want this one brown spot gone. So cosmetic goals is a really important factor in that, but in general, multiple sessions is indicated most commonly, especially if we're addressing kind of a full laser resurfacing, a fully aging picture, right? So I need more than one laser and I need more than one laser session to get patients. In general, people are looking for about 5 to 10 years off their skin age, and that in general takes about 4 to 6 sessions
Of laser
of
resurfacing.
laser
So kind of
resurfacing.
like your
Yeah.
mid, kind of more like a fractional ablative laser,
Yeah.
something like that.
Yeah. And then there's the other side of that question is, some patients elect to do something called fully ablative, which in one session we can really kind of address multiple areas of the aging, perspective. And basically that can get you really dramatic results in one session. So it just depends on kind of what technology we're using, but also your goals.
And one thing I would say is the skin type also matters for that.
Yeah.
Sometimes with, Fitzpatrick 1 or 2, we can go more aggressive and we can do those fully ablative cases, or even with the fractional, we can bump up the energy on those fractional cases versus, someone with more melanin in their skin. You don't want to actually go more aggressive because you get into kind of a risky territory. So your skin type can also affect how many sessions you need to get a similar result.
Mm-hmm. For sure.
So that kind of dives into our next question, which is what complications do patients risk if they are getting a laser procedure, maybe with someone that doesn't understand the full breadth of skin, and then also laser technology and settings?
Yeah, I mean, so I don't want to say common, but the most kind of like talked about complications would be pigmentation afterwards. So that can be hypopigmentation, meaning almost like a scar or a white spot, or hyperpigmentation where there's brown where the skin was lasered. And so those are the most kind of talked about pigment issues after a laser. So that can happen.
I would say I agree that dyspigmentation, either hyper or hypopigmentation, is obviously not a great thing to happen after laser. And sometimes that can be short-lived, like a couple weeks afterwards. And sometimes that can be something that's permanent, where that pigment either stays really dark forever, or, you just lose those melanocytes, the pigment producing cells, because the laser was overdone, in which case that's obviously a permanent thing for the patient, neither of which is ideal, but you don't want that permanent dyspigmentation for the patient. Other things that can happen after laser is you can get pretty bad scarring, where, sometimes it can even inhibit movement of your mouth or your neck or turning your head, if you get scarring on the neck. And the one comment that I have on that is that sometimes the most seemingly benign lasers have the worst side effects. Some of the worst complications that I've seen referred to us from outside practices are actually from something as simple as a vascular laser or BBL, which, is technically those are non-ablative wavelengths. But, you get one setting wrong on those, your joules are too high, your pulse width is not appropriate, and you can have massive kind of severe scarring for patients. That is a misconception that I see with laser complications is, oh, well, it's just a vascular laser, it's just a 532, it's just a BBL, what could go wrong? Well, actually, a lot could go wrong, even with something as seemingly benign as a non-ablative laser or a BBL or IPL.
I would say, on the other end of that is like, normal expectations as far as, if we're using a CO2, you can have redness for 3 to 6 months. That's a normal part of the healing process. We will walk you through that. We will kind of help as much as we can, but it can be that healing process for some patients that it does take that full 3 to 6 months to kind of get back to your normal kind of steady state as far as, coloring for sure.
Yeah, and I think that's where you interface with your dermatologist. You call them, ask them about normal skin healing, make sure that what is happening is something that is normal and that they expect, which is why we work with our patients very closely after every laser procedure, just to make sure that that healing process is 100% perfectly going.
And especially we practice in Florida. So, a lot of our patients are out in the sun, out boating, things like that. So you can have some, again, temporary pigment issues if you were to expose that fresh new skin to some, outdoor, UV rays. That is going to kind of change some of that. But again, we walk you through that, and it is a temporary thing, but it is something that can happen too.
So if you're getting a laser, what preparation can you do to improve results?
So I think in general, we can start using a retinoid or a retinol that can really help, preoperatively and safely postoperatively about 3 to 4 weeks after. That can kind of maintain some of the results, and it can help kind of resurface the skin in preemptive to getting a laser resurfacing. That can really help for sure. And then sun protection pre and post-op is really important. So the less, sun damage that you've accumulated, the better you're going to respond to lasers, and the safer that all the applications of the lasers are going to be for sure. So the other thing is choosing somebody who you trust, who, has experience with all those things. That's really important as far as doing your research, making sure that, again, they have experience, they have all the laser technology that you need to get the good results or the results that you're looking for.
So what care post-laser is the most important thing to remember?
I mean, number one is going to be sun protection. So avoiding the sun for, depends on what kind of laser we're talking about, but anywhere from 1 week to 3 months can be our recommendation. And that's going to be really important just as far as the laser healing process and to maintain or to optimize your results. The second thing is going to be keeping the skin nice and moisturized. So usually that recommendation comes with Vaseline or something that's more occlusive in that nature just for the first 24 hours if it's a lighter laser, to up to 2 to 4 weeks if it's a more intensive laser. So why do some providers treat too conservatively?
I see this a lot. I would say number one, because they just don't feel comfortable with the laser. They don't understand that laser tissue interaction, and they feel like they don't want to overtreat because they risk a side effect like a burn, dyspigmentation, something like that. So they would rather undertreat and, have the patient maybe be dissatisfied, but at least they don't have a long-term complication of a burn.
Yeah, I agree. I mean, I think also, some lasers and laser devices, they come with like plug and play applications. So sometimes, I mean, we have reviewed a lot of those, and we don't play by the plug and play, but some of them are way too aggressive and some of them are not effective and too light. So it can kind of go both ways. So if you have a plug and play device where you're typing in what that really means, just in case you don't know, basically you turn on the laser, you click the skin type that the patient is, you click the problem that they're having or that you want the laser to address, and then it spits out settings just based on basically the laser technology. So in that sense, you can either treat over aggressively or under aggressively just based on the fact that you're not actually using what's between your two ears. You're just kind of using your fingers to kind of go from there.
Yeah, I'd say that's a big problem is just trusting whoever made that protocol that's in the laser that it's going to be like perfect for your patient. Obviously, 99% of the time, I'd say it's not. So if someone's getting a laser with you, Dr. Kesty, what expectations should they have realistically about improvement?
In general, I would tell people that I want to go over what that expectation is before we do the procedure. So if it is one spot, it may take me one or two or laser sessions to get where you're comfortable with going out without that spot. It may take me, one session if it's a fully ablative laser to really kind of make 50 to 70% improvement in that deep line on your forehead. It can take me 4 to 6 sessions to kind of get all your vessels around your nose to be gone. So it depends on what treatment you're talking about, but also your goals too.
So definitely important cosmetic consult where you meet with the laser surgeon, tell them what you want, and then they can let you know about specific expectations.
Yeah, I think realistic expectations should be discussed prior to you venturing into a laser itself. If somebody's saying, oh, well, this one device can do all these things and it's all going to be in one session, I think you should kind of take a step back and be like, that's not exactly true. If you're saying, like, okay, I really want this spot gone, okay, yeah, in one session, I can probably get that done. If you're saying, I want to have no wrinkles on my entire face, I may need, a couple sessions to get you there. Again, it's just kind of in that conversation that is going to need to happen.
What do you think is the biggest mistake that people make when performing laser treatments?
I think the biggest mistake that, I see is basically somebody using one device for things that are outside of that device's capability. So even if the laser company says this device can treat X, Y, and Z, it may only be actually really good at treating X. But I see a lot of people try and treat Y and Z with that. That's what I think, is probably the biggest mistake that I see as far as like laser providers is if they have one technology and they're trying to basically overextend what that technology can actually efficiently and effectively do.
Yeah, I completely agree with that. I mean, we have so many different lasers for a reason, right? Because one laser is going to be good at X, one laser is going to be good at Y, one laser is going to be good at Z. So if you want to get the patient the best results, you really have to be able to pull in those different lasers. There's not one laser that is going to treat everything. Well, thank you so much for listening. If you have any questions, feel free to leave a comment.
Thanks for tuning in.